I joined an organization called Lewis and Clark Expedition Reenactors, and I portrayed Alexander Hamilton Willard, and he was a blacksmith. Well, in addition to being a blacksmith, I play golf and, of course, play racquetball. I noticed when I was playing racquetball, my shoulder was hurting a lot. Finally went for help. They gave me the shots, but they sent me down to see Dr. Carr, and he said, well, I don't know how you play golf because your shoulder is completely frozen.
He had bad arthritis and tendon injuries in both of his shoulders, which it happens, but it's much less common. And so he's very active. He's not an athlete in the traditional sense of the word, but he's an athlete in that he uses his shoulders in a way that the average person doesn't. And so with both shoulders being injured, we're able to treat him in a sense like we would an athlete, which is different than you might experience sort of in a different healthcare setting. My personal style in treating patients is to really focus on the patient and treat them not just as a number or as a diagnosis, but for who they are and what their goals are. So I like to find out from them early on in their care what they're looking to do, what they've done in the past, what their goals are for the future.
In talking with Dr. Carr, I said, well, I guess I can do my yard work, but I guess I have to quit racquetball. And he said, who told you that? Obviously, I don't want you bouncing off the walls for a year or two, but you can play racquetball when I release you. I think he's an exceptional doctor because he has fantastic skills. I was told he was the athletics doctor of St. Louis. He was the doctor that when the athletes had problems, he took care of them. And I think he had the skills with his hands and with his knowledge. He did what needed to be done, but he didn't go beyond that.
I think the biggest thing that I love about work every day is interacting with patients, interacting with people. The foundation is always working to support our community's greatest needs. Critical service lines like orthopedic surgery, community health, women's health, cardiology, neurosciences. Donors and supporters like you support vital programs, services, and the mission of SSM Health.
If life has been good to you, you need to give a lot of it back.